So, how are you today, Lily?
I'm good.
That's good. So, my name's Jan, and what I'll be doing today is just doing an adult pre exercise screening system with you, and it's just to get a little bit more information um, on your health, um, injuries, and any risk factors that you might present that might affect your training program that we're going to make for you later on. I just want to know that we have your consent to go ahead and to do this.
Yep.
Yep, you sure?
Yep.
Okay. So, what we're going to do today as part of the pre-screening session is take a few measurements.
Yep.
The measurements that we'll be taking will be your height, your just with the tape measure that we've got, your weight on some scales, and your waist measurement just with a tape measure, and we'll check your waist measurement. Are you okay with that?
Yep.
Okay. So I just want to ask you a few questions just to get a bit more detail on your goals and your current exercise program, and then also maybe your history and what you've done in the past. So, what are you currently doing at the moment? What is it that you want to achieve from your training?
I'm doing 3 days per week, and I do an hour each session.
Yep.
And I want to get strength and endurance and cardio endurance.
Okay, so you want to increase your muscular strength and your cardio endurance.
Yeah.
Okay, that's great. So we can definitely help you with that. Do you have any exercise preferences?
No.
Okay, that's great. So you said that you're currently exercising 3 days a week. Is that correct? For an hour each time?
Yep.
Yep, great. And previously, were you doing anything different to that, or have you been doing that for a while?
No, I've just been doing that for a while now. Yeah.
Okay then. So what we'll do is we'll go ahead and I'll ask you some questions. We'll start this pre-screening with you. Am I okay to go ahead and to do that?
Yep.
Okay. I'm just going to ask you a few questions. So I'll just get your date of birth.
The 27th
Yep.
of the 2nd,
Yes.
2008.
2008. Thank you very much. So, as I mentioned before, this screening system is just to help us identify if there's any known diseases, signs or symptoms of disease, who may be at a higher risk due to an adverse event while you're exercising, and just things like that that we may need to refer you on to an allied health professional, or we can proceed with getting a fitness assessment done for you down the track.
Yep.
So I'll just start off with a couple of questions. Has your medical practitioner ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
Great. Do you ever experience unexplained pains or discomfort in your chest at rest or during physical activity and exercise?
No.
Awesome. Do you ever feel faint, dizzy, or lose balance during physical activity and exercise?
No.
Great. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months? Okay. If you have diabetes type 1 or type 2, have you had trouble controlling your blood sugar glucose in the last 3 months?
No.
Great. Do you have any other conditions that may require special consideration for you to exercise? No other injuries or health conditions?
No.
That's great. Okay, so the next question I think you've already explained to me a little bit about, but we'll ask it anyway. So describe your current physical activity and exercise levels in a typical week by stating the frequency and duration at the different intensities. and the intensities would be light, moderate, or vigorous and high. So, is that correct that you said that you were training 3 days a week?
Yeah.
Okay, so would that be at a light or a moderate or vigorous intensity?
Moderate.
Okay, so a number of sessions per week at a moderate would be 3, is that correct?
Yep.
And I think you mentioned the duration was for an hour each session, around about an hour. Yep, great. So that would be 100 and, so duration total minutes per week would be 180 minutes. Okay, so I'm just going to work out what your total minutes of exercise are. Just bear with me. Light plus moderate. So 180, and you said there was no vigorous training that you did?
No.
Okay, so that's a total of 180 minutes per week. So with the fact that you're already training, and you told me that you've been, your history is you've been training in the past, and you're currently training at a moderate intensity for more than 150 minutes a week, then we can continue with your current physical activities and exercises and intensity level. How does that sound?
Perfect.
Excellent. So I'll just show you here. This is just a diagram of the different exercise intensity and the guidelines.
Yep.
So what we'll do is we'll just finish the stage 2 of the screening test, and then I'll come back to this and just explain what it means.
Yep.
Great. So can I get your age, please, Lily?
16.
16. Female. Do you have any family history that you know of heart disease, like a stroke, heart attack? Maybe it was either your parents, grandparents, uncle or aunties before the age of 55?
No.
No? Great. Do you smoke cigarettes on a daily or weekly basis, or have you quit smoking in the last 6 months? Great. So what we're going to do just quickly is, actually I'll finish up just with these questions, and then what we're going to do, Lily, is we're going to do your body composition,
Yep.
which is just taking some measurements of your weight on a set of scales on the floor, your height using a tape measure against a wall, and working out from those your BMI or your body mass index.
Okay.
Is that okay with you?
That's perfect.
Okay. So I'll just ask you 2 more questions.
Yeah.
Actually, a few more questions, and then we'll go and do your measurements.
Yeah, perfect.
Great. Have you ever been told that you have had high blood pressure?
No.
Okay. Are you taking any medication for this condition? No. Have you ever been told that you have high cholesterol or blood lipids?
No.
No. Do you know your cholesterol readings, like your HDL and your LDL?
No.
No, that's okay. And you're not taking any medications for that. Awesome. Have you ever been told that you have high blood sugar glucose?
No.
You're not, so would I be correct in saying you're not taking any medications for this?
Yep.
Great. Are you currently taking prescribed medications for any conditions? These are additional to those already provided? Great. Have you spent time in hospital, including day admission, for any condition, illness, injury during the last 12 months?
No.
Great. Are you pregnant or have you given birth within the last 12 months?
No.
I know these can be sensitive questions, so I appreciate your honesty. Do you have any diagnosed muscle, bone, tendon, ligament, or joint problems that you have been told could be made worse by participating in exercise?
No.
No. Great. So that they're all the questions that I have. What we'll do is we'll just pop over to the wall and get your measurements for your weight, your height, and then I can work out your BMI, and then we can go from there.
Perfect.
Right, just pop over here. Okay, so Lily, if I can just get you to stand flat up against the wall. Perfect, and just put your head on the wall and look straight ahead for me. And we'll just do your height. Okay, so you are, let's see, 171. Right. So 171 centimeters is your height. If I could just get you to stand on the scales for me. Great.